that some of the things that made me who I am started with high school even, because I have been interested in writing and in other people's writing for a very long time, and ever since I was in high school. And I owe a lot of that to an English teacher that I had when I went to high school in Hoorn, Michigan. And she was an amazing woman who got us to think about, we spent almost half a year on reading Macbeth. Every teacher that I had that would allow me to look at how the thinking of the culture came about, I just loved it. I loved to read, and I loved to explore what different writers had meant. And so I think that really has shaped a lot of my career, because although I went into science and had this desire to understand how things worked and to understand the inner workings of all things living, really, I'm not a mechanical person at all, but all things living, I went into science, and I started exploring initially in zoology. I went to Michigan State and got my bachelor's in zoology. And during that time, I wanted to go to vet school, but I wanted to also have a degree that would allow me to do other things. So I picked my degree really based on, I loved zoology, but I also picked my degree because it had the most electives available. So at that point, I could take a lot of English classes, and I could make myself into sort of a much broader person than your typical scientist, I think, because that was important to me. And I think I always wanted to be a writer. So I did a lot of creative writing in high school and in college, and then eventually did get into vet school. So I have this scientific blending with my other interests, and maybe my more true interests in thinking and writing and reading. So I went on from there to went to vet school, really enjoyed it. But while I was in vet school, I started doing research in the summers because I needed something to do. And they had a research program for undergraduates, and I started working in laboratories probably right after I got into vet school. And it was a great experience, also at Michigan State, and I learned a huge amount, worked in parasitology and worked in pharmacology and a whole lot of different areas. But that was very early days for any sort of animal care and use. And being a veterinary student, obviously, that was important to me. So I think some of the experiences that I had there helped to shape my thinking about how this is supposed to work and how are we supposed to be handling these situations with animals.
Could you please tell me a little bit about your parents and your family of origin and your childhood, and what influences might have impacted your character development?
I grew up in my father's Hispanic, and he actually was from Texas and had moved up north after the Korean War. And so I grew up in a northern suburb, and my mother's English, and so it was kind of a mixed culture family, and that was very unusual in that part of the world at that time. My father, I think, was kind of embarrassed to be Hispanic and he used an English name, and he never taught us to speak Spanish, which is such a shame now. But my parents got divorced when I was about in 6th grade. So after that, he had moved back to Texas, and it was really my mother and my sister and I. So it was a community of women, and we would travel with my aunt, who was also single. And so we had a little cadre of us that would go on vacations. And even when my sister was about 10 years old, people would think we were school teachers on vacation. I had a really good relationship with my mother, though, and with her parents. So we had I'd say for a small family, it's a very close family. And my mother was an amazing woman because she was able to, she worked right from day one. She worked all the way through and was the main supporter, even when she was married, of the family. And she worked all through when I was in school, and eventually went back to college because she had never done that. She had me right out of high school, so she went back to college. and got her degree in some form of business. She worked for General Motors, and so she had been working initially as a secretary and then worked her way up into writing manuals and things, which is another thing. I think I got some of that writing interest from her. But she's a manic traveler, so we would drive everywhere. And I think just being with her and seeing she wasn't afraid of anything. She went downtown to Detroit to go to college all by herself at night. And she actually graduated. It took her a very long time to get through college. She graduated from college at the same time my younger sister graduated from high school. So but that was the culture of my family. I started working in research labs when I was in college. So I was just graduating from, I had graduated from my undergraduate. And when I was an undergrad, I did a program with Dr. Richard Hill, who was a zoologist at Michigan State, and he had a class that was an introduction to research. Best class I ever took, and I think changed a lot of my direction because it was the first exposure I'd had to doing science in a hands-on, creative way, not just following a book. From that point, after working with him in that class, I was very interested when I got into vet school in trying to find more opportunities. So I started in a research for undergraduates program and got very involved. When I first started in the laboratories, I don't remember an IACUC. There probably wasn't one. That was in the late 70s. Probably wasn't a whole lot going on in that regard. There were things that happened in labs that I questioned because I was, of course, very concerned about animals and animal use, and I was going to be a veterinarian, so it was important to me. And so would ask a lot of questions, and I think that at the time, asking questions made people somewhat uncomfortable, or they would consider you not really serious about what you were doing, because there was a concern that, they needed people to be very focused on the work and not be bringing all these exterior issues in. And this is I don't know, I can't tell you how prevalent that was, but I just know in the situation I was in, there was a lot of things that it was just the way things were done. And nothing terrible, just I always felt that there were things that could be done better, and would ask, why do we do this? Why are we doing it this way? And after some time, I ended up eventually in the pharmacology department, which is where I eventually came back and did a PhD. The person I worked with at Michigan State was a great guy, really easy to work with, and had a wonderful respect for veterinarians as researchers. He was kind of one of the first people to pull in a lot of different veterinary students and postgraduates and pull them into his lab. He felt that combination of knowledge that you get from being in vet school was so important in understanding the big picture for research. So that was a great introduction to the whole world of in vivo research, which I really hadn't done much of before. And when I was in his laboratory, he encouraged me, and others in the lab who were veterinarians encouraged me to stay in research and not even bother with practice. But I felt like after going through all these years of vet school, I really wanted to see how it all worked, and could I really go out there and diagnose something and help animals get well, and all the things that you learn in school. So that was, I think that at that point, I really wanted that opportunity to be a practitioner. But eventually, I did remember my experiences there and ended up doing my PhD in that same laboratory in pharmacology and toxicology. So when I was young, I was one of those kids. I was never very mechanical. I spent a lot of time outdoors and imagining things. I lived in a suburb, so I was not in it was a fairly lower middle class neighborhood, and lots of kids, lots and lots of imagination type things that would go on at the time. And I think my interest in science came, honestly, I don't know where my interest in science came from. I remember even as a very young child being very curious about, it sounds terrible, but I would find like a dead animal or a dead bug, and I would be interested in it, not squeamish about it, but just, oh, look at this. So I think, going to the shore and seeing different looking at tide pools, all of these things. I just really like nature. I was very interested in the way that things worked. Um, I think originally my goal was to work in a zoo and maybe be Jane Goodall. She was my hero at the time, and I just thought that that was at the time when she and Diane Fossey and they were all out in the wilds, and I thought that would be a perfect life, and then I can come back and be a curator at a zoo or something like that. So I think more on the natural history side of things initially. My mother comes into this again, though, because she was one who, she had been married very young, went through and worked her way through, and her feeling was very strong that you don't be a nurse, be a doctor, and don't be a school teacher. And this was in a day when not every woman went to college, and certainly not every woman went into a scientific career. But she was very adamant that this was not something that your career was really important. You can have a family, you can have all these other things, but you need to worry about your career first. So we got a very strong dose of that. And because I was so interested in animals, loved science, veterinarian seemed like the obvious place to go with that. And I don't think anyone really knew or thought about research in my neighborhood in those days, and certainly not in the science classes that I have ever had in school. So it was more reading, my love of reading, and just the natural world that kind of pulled me in, and probably would have been an environmentalist and wandering the jungles if I had totally been free to decide what to do. But wanted to be practical, so I became a veterinarian.
And did they offer a course in veterinary medical ethics during your time at vet school? Or was there any exposure to ethics?
As far as exposure to ethics in my education, I honestly don't remember a class in ethics. I remember that in vet school there was a very strong emphasis on becoming as broad as possible. They wanted us in vet school at that time to become experts at all species, small, large. We had to do rotations in the field. We had to do surgery. We had to do a huge range of things. I believe that that's changing a little bit now and people are able to specialize. But because of that, all the information that we were squeezing in, I don't know that I remember specifically an ethics course. What I do remember is that there were some extremely conscientious and ethical people that we worked with in vet school. And some of the veterinarians there, I believe, had, there were many with research backgrounds. Obviously, at a veterinary school, you have a very broad mix of people, and many of them are scientists themselves. And so I think science was prevalent, the idea that clinical medicine was one side of things, but research medicine was another, and they were very active in both. As far as the ethical side of things, I think it was instilled more by example than by class. And I do remember some faculty members that, particularly one very short program in pocket pets. And the doctor who taught that was someone who had a great respect for all creatures, great and small, and was very inspiring in terms of that. But I don't remember an ethics class at any point in my career. So I think that all came through experience and questioning on our own at that point.
At some point during your vet school education, did you begin working on animals and performing procedures on animals as part of the curriculum?
I went to vet school. I graduated in 1983 from Michigan State, and I had done my undergraduate at Michigan State, and then I did my veterinary training at Michigan State, and later went on to do my PhD at Michigan State. So I really didn't move around much. I think that when I was in vet school, we did use animals in the curriculum. It was a time when I remember there first being some discussion about should we. Right. When I was a junior in vet school, we started our surgery program, and that was when we really first started working on animals. The first 2 years of vet school are really just book learning. You get the foundation, and then junior year they started to introduce more clinical type things. So surgery, strangely enough, was one of the early things you learn. And those surgeries at that time were not survival surgeries. They were terminal. And that was really quite an ethical way to do it. I mean, you have students doing their first surgery, and I'm not sure recovery is really the best option for some of those animals. But it does mean that you go through a certain amount of animals. So that was, of course, very difficult. Probably get someone in trouble, but I know we adopted a dog. My roommate and I adopted a dog out of junior surgery lab just because before we even got started, we said, oh, we love this dog. And so we, got the guy who was in charge of dogs to help us spirit that one away. But I think that, you do learn a huge amount by handling real tissue. And I think that that is not something I would have wanted to be doing for the first time on a client animal. And it was really important to have the experience of working with live animals in surgery. I believe these days, and maybe in my dream world, the more appropriate way to do it would be to have a little bit more experience under your belt when you start that, and then be able to do those as recovery surgeries. One of the really interesting things when I think back is, we use a lot of analgesics now in research. Almost everything that has any remote possibility of pain or distress an analgesic would be used if at all possible. When I was in vet school, I remember as a senior in a rotation in anesthesia, and I remember the instructor coming in with a little vial and saying, oh, I got this new stuff that just came in. And it's supposed to be a pain reliever, and they want us to give it a try. And so before that, no analgesics whatsoever for surgical animals. And this would have been in 1983, maybe 1982, depending when that was. But I remember that, bringing that stuff in, and let's give them some and see how it goes. And so, we used anesthesia, and some of the anesthetics do have some post-operative benefit. But that was the very first dose of analgesic that I saw administered. Those were days when I think that the thought was that animals would be quieter if they were in pain. They've had surgery, they'll stay quiet now, they'll be in their cage and they'll rest, and the pain will keep them from being too active. It's like a natural protector for the animal. And really, since there was no pain relievers available, I suppose that's a theory, but it's incredible how far we've come when you look at that. Because now even a fairly minor procedure, you would be giving something to help with that, to minimize that.
Did you, in the course of vet school, ever see any research labs, or did any of the research lab practices come to your attention that were concerning?
I think there were methods of euthanasia that seemed more extreme than, things that we wouldn't be doing now. And I don't know that they were really, looking back on it, I know I didn't like doing some of the methods of euthanasia that we used early on, but I think they were at that point considered state of the art. I think we used ether when I was in grad school still, and there are a lot of things that were done under ether. It was perfectly legitimate at the time, and it did create a good state of anesthesia if you used it correctly. I also saw some fires in the hoods, but there are things that I remember less than fondly. But again, I know at the time that was the common practice, and that was where people were in their state of what's the best way to get this done. And I don't think that the animal suffered, but I think that I suffered in having to administer some of those methods. So this may surprise you, but I'm not a lab animal veterinarian. When I went to vet school, originally my plan was to be a zoo veterinarian because that fit in with what I always wanted to do. I wanted to work at a zoo. Unfortunately, I got practical really early on and realized that there weren't very many zoos, weren't very many veterinarians doing that, and that the background that you needed, it wasn't a very practical choice. So I thought about it, but the next best thing was to be a large animal vet. So that's what I really wanted to do, was be a large animal vet. When I graduated from vet school, actually I had done my training. There was very little ability to specialize at that time. You could do a couple of extra rotations in something that you really liked. And I did a few I did a preceptorship in a mixed animal practice in Battle Creek, and then I did something in epidemiology where I went out to farms and helped investigate different situations when I was still in vet school. And so, but I kind of geared myself towards going into large animal practice. And I think I really don't know why I did not grow up on a farm. I grew up in a suburb. When I was in undergrad, I did livestock judging for a while because for some reason I was really good at it. I don't know why. I remember one of my instructors asking me, Cindy, did you have pigs when you were a girl? I said, no pigs, because I just seemed to be able to figure out which pigs were better than others. But so I liked working around livestock. I just thought they were interesting, and I guess it was close to being a zoo vet. But when I graduated, I started looking before I graduated, I started looking for a job. And I'll tell you, this was in 1983, and while the farmers were perfectly happy to have a woman come out and be their veterinarian, the other veterinarians were not quite so kind. And I actually remember I went on a job interview, and I was dressed up for my job interview, as you would do, and that guy took me out on farm call and made me lay down and feel a torsed uterus in a cow, all dressed up. I did it. He had no intention of hiring me. I found out later he had already hired a classmate of mine. So it was there was a very strange way of treating women in the profession. And although I do have some good friends who I graduated with who did end up in large animal, it was not a very easy path at that time. And I did end up in a small animal practice. So, but I was never went into lab animal. I went through the research route, and then I went to get a PhD. And so that's how I got into this whole research and IACUC field, was more as a scientist rather than as a veterinarian.
How long did you work in a small animal practice, and what was your next step?
I was in practice in Battle Creek, Michigan for about 4 years, maybe a little bit longer. I had originally, when I was in vet school, I had worked in research laboratories, and they had encouraged me at that time to stay in research, and I said no, I wanted to try out practice. So I ended up working in a very small practice in a fairly small town, and it was an interesting time for veterinary medicine. I was on call every other night, every other weekend. I made $18,000 a year when I graduated, and I think after 4 years I was making about $22,000 a year. So it's not a very lucrative field. Very much in debt still from college, although not as much as they are these days. And after about a year of being in practice, I realized that it was either boring or fly by the seat of your pants, one or the other, depending on what you were doing. It didn't take me more than a year or two to say, I think I want to go back and get my PhD. But I actually met my husband in that time, and we got married, and so I always tell people it kind of distracted me for a few years, and so I stayed in practice about 4 years. It was fun when I was in practice. I worked with the Veterinary Explorer group with kids, helping them find out about being in veterinary medicine, and I had a good experience doing it. It's just that in the situation I was in, it was extremely not a very wealthy area, so there was a lot of animals that rather than being able to give them the very best treatment, they would opt to euthanize the animal because they couldn't afford to have anything done. So we either would refer the interesting cases, or we would end up with just kind of making do with the best that we had in hand at the time. And it was kind of very different than the very specialized way that we practice veterinary medicine today. So it was a long time ago in terms of that. So there was, at some point there, I decided I would go back and get my PhD. And although I worked in vitro and I worked with cultured cells, I think something I learned very quickly is that you cannot distance yourself from the animal side of things because those cells came from animals. And so I worked with vascular cells, so in order to do that, I had to go to a slaughterhouse to collect arteries and bring them back to the lab and do the work. So that was not a place I ever envisioned myself going, but I quickly learned that if you're going to do that kind of work, that's how you do it. And so, in a way, it's nice. It's a side product of something that was already being done, so I was making good use of this resource, and that felt good. I think that there are a lot of people that work students particularly that say, oh, I don't work with animals, I work with tissues, or I work in vitro, but they've, really think sometimes we forget where those cells came from, even if they are cells they've purchased from someone. Somewhere along the line, they started in an animal, in a human, in a tumor, somewhere. It's not, I think that we forget sometimes that the source of all of this tissue and much of what people call alternatives, does have its source in animals too. So I tried, I think it made a big impact on me that this didn't just miraculously appear. There was a process of getting it. And while I felt very uncomfortable, I don't know what the right word is, I won't say horrified, because it really wasn't horrifying in a slaughterhouse. It's, there's a process to it, and they're professionals doing their job, but it's not a pleasant place. And I think that it does change your whole view on how you look at the way that we treat animals, and the fact that your meat doesn't come wrapped in plastic, that it really does come from a place like that. And that was a big impact on me. But having said that, I still would prefer doing my work that way than having to work with rats or mice or guinea pigs or something like that in the lab. Things were very open in terms of animal use in those days. The animal facility was open for tours. You could go through, anybody could ask for a tour. So this would have been in the 80s. I know that the animal facility was quite open. People were able to go in and ask for a tour. And, obviously most of what you see in there is just animals living in cages and, going about their business. So there was really nothing traumatic about that. But obviously there were a lot of different kinds of projects going on in the department, and we did have to do rotations in different laboratories. So I did work with rats at different stages in my career. I got kind of allergic to them, so that made it a little bit harder to do. I should have mentioned that one of the other encouragements to get out of veterinary practice is I became very allergic to animals. So, and I learned that's a very common side effect for veterinarians. They actually had a society for animal allergic veterinarians. So people get driven out of practice by that. I think that the veterinarian's relationship with animals is a really complicated one. Even in practice, there are very practical applications of medicine and things that you can and you cannot do for free. There were constantly questions of, I'm just going to do this because I'm not going to charge them. I'm just going to do it because it's the right thing to do. But a lot of what you do, and a lot of the patients or the clients that I grew closest to when I was in practice, were people whose animals had died while I was working with them, because I think that them seeing that you cared and that this was something that you went through together, I think was extremely valuable to them. They really appreciated that your heart was there with them while you were going through that. Even in practice, I think there were times when you had to do very hard things. I remember I would go speak to school children, and the children would always, always, always ask, how can you stand to put animals to sleep when you're a veterinarian? You're supposed to love animals. I said, you know what, sometimes loving the animals, that's the nicest thing I could do. And I really felt there were times when that was really a blessing to be able to do that. Yeah, I think that in research, we're weighing, even when we're weighing the costs and the benefits of what we're getting out of the animals, I think the importance of the field that we're in lab animal science is that we want to understand, we know the value of research, and having come from the research side, I appreciate that the value and the need and the importance of biomedical research. But the veterinary side of me and the human side of me realizes that this is not the way that we necessarily would like to do things. We would not necessarily like to have to use animals. And when we do, trying to do that in the very best way we can with the least impact on the animals is the most important thing. The fact that I think that the dilemma that comes in being a veterinarian is that you have a really good awareness. I think most of us go into veterinary medicine because, at least in part, because we love animals. I don't think anybody goes into it for the money these days, at least. I think it's it's a field that you do in part out of love. And I think that the reason that people get into lab animal medicine, although I'm not a lab animal vet, I believe, is because they see a need and the importance of somebody to speak for the animals and to be in that role. I think that it is important not to take that role to the point where you can't appreciate why you're there, that the need is there for the work. But it is something that I think every veterinarian, and I'm sure most every scientist struggles with. It's not the way that anybody would like to have to do research if there were an alternative. I graduated with my PhD from Michigan State as well. I had my degree was in pharmacology and toxicology and environmental toxicology, and that was in 1992. And from there, I should have gone to do a postdoc. That was the accepted route, that you go through your PhD and you do one or maybe two postdocs. But because I was older, already had my veterinary degree and I had already worked for a few years, I was treated like a postdoc when I was in grad school. And I did not want to do another postdoc. So really what I also realized while doing research is that the scientific research involves very close look at very tiny things. And I am really a big picture person. So I did not want to go into the same kind of situation I was in a big research university. I wanted a broader career of helping students understand about science. I think science literacy to me is a huge, important thing in our culture. And it was really important to me to try to have the opportunity to not only do the research, which was, interesting and allowed me to have some different types of work and different types of learning, but what I really wanted to do was work with students. And so I looked for a job right out of school, and I found a position at Western Michigan University, which is one of our regional universities in Michigan. And it was a biology program. They had never hired a veterinarian before. I was hired to teach human physiology, which was interesting, but also to start a research lab. It was very important to them at that time to build up the research program. So I started in the department in, that would have been 92. Started out with a very tiny little research budget and was supposed to set up my lab to continue to do cell culture work. And we had a master's program at the university, so I would work with them, the students, teaching. We had very heavy teaching loads, so I would teach, and then I would do research in the summers, and as I could find time, have different students come in and help out with different aspects, although they had very limited time as well, so it was kind of a strange way to study. When I was a graduate student, I was full-time, basically working in the laboratory. These students didn't have time for that, so we would have to fit in experiments here and there while they were learning. But it was a good experience for me. I enjoyed being in a university environment in that I had never given a single thought to plants in my life. And I was in a biology department where we would have a seminar program, and one day it would be about yeast, and one day it would be about plants, and one day it would be about animals. And I was actually a toxicologist, so I taught a class in toxicology, I taught cell biology, I taught human physiology. It was just very diverse, and I liked that. But ultimately, I realized that doing that kind of work, that I think university environments are extremely political, and there was a lot of demands on your time. And I think what I was realizing that after doing a lot of committee work and a lot of teaching is that my strengths really were not in the lab. My strengths were in teaching and in working with students and in actually doing administrative stuff, which most people hated. And there really wasn't much opportunity for recognition in that. I had received some research grants and I was doing fine, but I just quite honestly didn't enjoy doing it. So I eventually just made up my mind that I was going to try to work my way gradually into some other direction, but I didn't know what that would be at that time. So I kind of threw myself into my teaching and just hoped for the best.
And how long did you stay at Western Michigan?
I was at Western for about 5 years, And at that point, I had for maybe a year or so been working as a non-affiliated scientist at a local pharmaceutical company. And at that time, it was Pharmacia and Upjohn, I believe, and worked for them as a sort of as a. I think that they had a philosophy of having the required on their IACUC committee. They would have their required non-affiliated member, and then they would also have a non-affiliated scientist who would give an outside perspective on the science. So I took that role as the non-affiliated scientist on the committee and served on the IACUC there for, it was a year or two, I think, while I was still at Western. And somewhere during that point, this really interesting thing was happening in the IACUC world where, although the regulations had been out for a while and the guide had been out for a while, the focus on how that was being implemented was changing. And they really realized at the company I was at the time that they needed someone with a little bit more than just a administrative, like rather than an administrative assistant or a veterinarian doing this part-time. They needed someone to focus on that role of IACUC administration and get them into the place where they wanted to be in terms of compliance. So I think that was a new opportunity. I realized that this could be perfect for me. I was a scientist, but I also had teaching experience, and I was a veterinarian. So it was kind of a crossover role where it would be very beneficial to have all these different aspects of my background come together and be able to put them to good use. I had worked obviously with the IACUC at Western because I was doing, I would have to go take my students off to collect arteries, and we would still have to have some oversight of that activity. And also the fact that I came from a big research program, I had the expertise to share some of that background with the department, which was quite small in terms of their research program. So I think that having had all that experience, when they decided to create this position at Pharmacia and Upjohn, it seemed like a perfect opportunity. So I made the transition. It's interesting that I was at Michigan State for 5 years doing my PhD, and during that time I had one interaction with the IACUC, and that was when I was submitting my grant. I had a grant during that time, and again I was doing in vitro work, but they decided that I needed an IACUC protocol for some aspect of what I was doing. And it was, at that time, I remember about 1 page, I think I had to fill out, and I never saw it again for 5 years. So I don't know how that worked, but that was the way it worked at that time. When I went to Western, again, I did have to go through the IACUC for some aspects of my work. I used bovine serum albumin in my cell culture, so I had to have some sort of review of that, and I had to have some review to go out and collect the arteries. So I had an interaction with them, but again, it was a very abbreviated process, and I think that there would be inspections and there would be things like that, but it all was very background. Nothing that was disruptive to my work, and I realized I was not doing a lot of whole animal work, so I wasn't the focus of them. But it's interesting how little I had to do with the IACUC when I was at Western, other than occasionally in an advisory capacity or maybe helping out with an inspection. Or we were actually building a new science building at the time, and there was a lot of discussion about what that facility should look like in terms of animal housing. But when I got started working on the IACUC at Pharmacia and Upjohn, that was my first real exposure to a whole process and program review and inspections and protocol review, and at that time entirely a paper process. Tons of paper. I would get these stacks of protocols to review, and they were all written, every detail was, I almost think some of that was handwritten too. It makes me sound like a dinosaur, but I think that it was a while ago. The process at the time was extremely veterinary driven. The veterinary group, in fact, I remember when I was considering taking the job, I talked to a friend of mine who was a scientist. He was a graduate student I knew that had gone to work for research company, and I told him I was thinking about taking this IACUC position. He said, "Oh my gosh, don't do that. You'll be a pariah. No one will like you. Everyone, the guy at our facility is in the basement. No one likes him." And I said, "Oh, sounds delightful." But it was very typical at that time that the IACUC and a veterinarian of some sort were synonymous. And I think what was just beginning to happen when I got into the field was that it was not just veterinarians anymore. There were the first few people that I met in the field that were actually what I would consider to be IACUC professionals. They were few and far between. I could count on one hand the number of people I knew who were not, I'm not talking about maybe an administrator working just to keep the paperwork for the IACUC, but either a scientist or a veterinarian or someone who was working not as a lab animal vet, but working for the IACUC specifically. It was just a very early days in the separation. I think originally people saw that as, the animal welfare is the veterinarian's job and not as the scientist's job. And it created this separation, which was extremely stressful. I think when I started working in that role, I think the first thing I had to do was overcome the thought that I was the police and I was going to be coming in and, passing judgment, and we were going to be having all these acrimonious interactions, and it was going to be a really ugly constant battle for them wanting to get their rights as scientists and me telling them what they couldn't do. And so my perspective right away was that we need to work together on this. And that's community. I think that's important to you. It's important to me. Was how can we manage to do this in a collegial way, because we all want the same thing. We want the research to go forward in a compliant way. Yeah, I think that at the time, the people were either very driven to get protocols approved, and their focus was primarily on, let's not get in the way. Let's just get this done and let them move on and do what they have to do. And then there was the other half who felt like every single step that researchers took was, kind of a defiant move that was thwarting their purpose as veterinarians. It was there was a lot of separation, and there were veterinarians on both sides of that. I mean, there were people who who saw themselves aligned primarily with getting research done, and there were people who were aligned very much with, let's just do everything the very best way possible. And I don't know that either one was particularly productive, because there was it was difficult to get the cooperation that you need from the scientists when they felt like they were always being antagonized versus, clearly we didn't want to be a rubber stamp organization. What I have to say is that the people who serve on IACUCs, and I found this throughout my career, no matter how they came into it, almost universally became advocates once they had done it. We used to use service on the IACUC as sort of a punishment at some points in our process. When someone would have a compliance issue, you need to serve on the IACUC, and we would bring them in and do that. I think that doing that usually was extremely effective, because they would appreciate what went into the deliberations and how important it was to consider things from both sides. And they would become great advocates, because they were mostly scientists who would go back to the other scientists and be spokespersons and explain, why is this important? Why do we do things the way we do it? The other side of things, though, was the occasional recalcitrant person who chose not to do that. I remember we wanted to start a newsletter to try to educate people in between training sessions, just to have like a monthly update. And I know the safety groups used to do this, where they would have to sign off that you'd read the newsletter and you'd absorbed all this scientific information. And we thought we would do this with the IACUC as an interim mode of training. And most people, took it under their wing, and they were supposed to sign it and just put it in a file and have it to show they had had that training. And I remember receiving an envelope once with the newsletter torn into little tiny shreds in an envelope, sent back to me. And so, you know, it wasn't 100% positive in those days. There was definitely an us-them feeling that I came into, but I do think that over time that really has changed. And I think that the people now, I think having lived under this environment of both realizing the risks of not doing things right and recognizing that we are trying to work together to make this a better process and make it a better, get better research out of it in the end. I think we've come such a long way with that these days we don't see nearly the resistance that we might have in the earlier times. Of course, the process, it's funny because the process is much more complicated and time consuming now than it used to be. It used to be fairly minimal, and they complained a lot more about it. So I've been working in the pharmaceutical industry now for over 17 years, and I think that the kinds of changes that we've seen so many changes in the industry itself in terms of the money is just different. When I first got into it, I think that there was a lot more money around, and I think that things that happened at the industry, they were much more eager to look at lots of different things and be working on lots of different things at once. And now business is definitely driving the car. It's very important to be, drugs are incredibly expensive to produce, and they need to be productive when they come out, or we can't afford to make them. And I think that's something that it's changed everything, because the cost of compliance has also gone up at the same time. And so it becomes a bit of a battle for resources. I think that we've been very fortunate that the company I work with, I know we have incredible support for the animal care program. And I think that as I've seen over the 17 years, it's gone from a necessity to just an accepted part of what we do and the way we do business. But unfortunately, there's less and less money to do all of the business with. And so I think that's been kind of a struggle for everyone, trying to figure out the best way to make sure that we stay in compliance and that we have sufficient people to do the job, and that everything, that we have time and energy to take in all the things that need to be considered. But I think that over the years, the changes, the economy has kind of driven things, but also, as I said, the recognition that this is a team effort and the scientists need to be engaged in it and that we're all on the same side, I think has also been a huge change. And we do have a lot more support, as I've seen, from the scientific community too. So it doesn't feel quite as much like an us-them situation as it used to. And I think that also the fact that we're operating under a tighter budget makes us all feel a little bit more like we're all on the same side. So in a lot of ways, the changes have been really positive. We've also become much better at relying on each other. Now, I've always felt it's a community, and I have benefited so much from, what is it about? It takes a village. It takes a village to have a career in this field too. And from day one, when I first took the job as a new IACUC administrator, I got so much support from people who I never had to create anything. People would say, oh, do this. And coming to a PRMR meeting was just the most amazing, eye-opening opportunity. My IACUC chair, when I first started my job, said, look at this meeting they're having. And we came to a meeting at Paradise Point, loved that place, and we had a wonderful experience. And we went back and we just sat down and we had a whiteboard, which we completely covered with things that we needed to do to get the program in shape. And I think that that meeting, I was introduced to so many people. They heard I was new. Everybody offered support, help, got to know people so quickly. And I think that the welcomingness and the supportiveness and the cooperativeness of this field has just really helped everybody in it to advance so much more quickly than we might have if we had all been much more proprietary about the work that we were all doing together. So, and I think PRMR's been a big part of making that possible, bringing us together and helping us to feel like a community or a family rather than just separate people going about our competitive roles. So I think we have struggled, and this has been a struggle since I started in this field, with the public perception of what we're trying to do in research, and it's gone up and down. But I don't think the public has a very good understanding of what we do in science or what we try to do in lab animal science. I know that I've worked with students throughout my career in different ways, either in schools or working with them in different programs, and it astounds me how little they know about science and about what we do in the industry. And so I think that as I watch, I remember my first research grant that I wrote, I was successful and actually got funded, got a good score on it, but they were funding much higher percentage of work than they are these days. As that number goes down, even though we have a lot of money, so it still sounds like a huge amount of money for research, I think that people are being pushed into a lot of different modes of getting cash to do the work that they need to do. There's a lot more alliances between industry and academia, and we're doing a lot more work with contract research organizations. And I think all of those things are a consequence of the lack of financial support for the industry. Would that be helped by people understanding more about what science can do and what science can't do? I'd like to think so. I think that I think we have a lot of important ethical decisions to make about what do we want to spend our money on, what is important, how important is health, how important is, we have an aging population, and I think that we have an increasing population still. How do we use science to address those questions, and how do we save our planet with science if we don't have the knowledge that's required? So I think the concern that people don't, as the need increases for more and more information about everything from the physical world to the medical world, we have less and less money to spend on it, and people have less and less appreciation for the value of that. So in my mind, education is the heart of it. So if we don't get out there and talk to kids about what science is and how it works and why all of us, it depends on everyone, I think that we're going to be fighting a losing battle right all the way down the line. So I really think it's important that we continue to educate. And I say children, but I think that applies to anybody outside our little sphere. We can't just be talking to ourselves anymore. We need to be talking to everyone about what we do and why it's important. I think that the fact that we have an ever-increasing need for new products, particularly in the developing world where there is no money to pay for those products, is a huge issue for us as well. Pharmaceutical companies, it costs more and more and more every year to create a new drug. We are doing everything we can to try to get better at predicting what drugs are going to be successful and try to improve the success rate so that the cost per drug will go down. In some ways, we've done a good job with that. In some ways, maybe not so good. But the fact remains that there are areas of need that are never going to pay for themselves. They're never going. At parasitology, we have parasite problems in huge sections of the world, and those are people that have no money to pay for those drugs. What do we see? There really isn't a lot of work going on in parasitology anymore. There is. I think that most recently, the work that I've seen go on has been more even for pet products, because the parasites in pets, people have money to spend on their pets, and they don't necessarily have money to spend on their children in certain countries. So clearly, pharmaceutical companies take a lot of heat for that, because everybody sees the need, and no one sees the other side of it, that it's an extremely expensive thing to do to produce those drugs when there's no payback. I do think, though, that the companies have tried to take on some social responsibility in terms of, making products available when they can and to the extent they can. I haven't been particularly involved in that. I do know we have a Global Fellows program where we do send out, one of my colleagues is on her way off to Africa now to be working in that field, to help in a developing market, to try to help them get some support for drug distribution. So I think there are programs, there are efforts, but it's a huge problem because we aren't creating drugs for some of those purposes specifically. There needs to be some way to pay for that production process, and we haven't really figured that out yet. Hopefully an academic solution will come. Maybe we will have a recognition of that need. We'll provide some funding going in that direction, but I'm not totally familiar with that, so I can't say, but I do know that's been a big concern for everybody, and certainly something that the pharmaceutical companies have been criticized for not meeting those needs as well as we might. I think that the efforts regarding the 3Rs and everything that the community has been doing, that has been one of the biggest pleasures and one of the biggest frustrations of my career. My job right now is related not so specifically to the IACUC, but to more about communicating internally and externally and responding, having a common voice when we talk about what we do. And the 3Rs has been a really important thing, because if we do get more questions about that than almost anything else from the public and from investors and from all sorts of directions. So people want to know what's going on with this. How are we actually doing? Our company has had a 3Rs awards program now since about 2008, and I think it's been a really great way for us to recognize ourselves, all the things that we're doing. One of the things that we have a problem with, though, is that we don't speak the same language as the scientists when we talk about the 3Rs. We say we want to talk about 3Rs, about welfare, about this and that, and they do it as part of their job. Part of good science involves trying to do things more economically, but also you have limited amounts of drug to use, and so I think a lot of the changes that they make for good science, but the good science contributes to the welfare of animals as well. So although their drive is not the same and their direction is not the same, the outcome is the same. So what we've been trying to do is recognize the changes that they have made voluntarily. Some of it has obviously been welfare-based too. I think that the scientists appreciate the need for that as well. But I think a lot of what they do just as part of the scientific process, doing good research on what the options are. What are the alternatives out there? How could we do this without animals? Could we do it a different way? Do we really need to use monkeys? Can we use some other form of rodent if we're going to do this? The number of animals used in certain types of studies has dropped almost to nothing, to a handful in recent years, for all those reasons. And I think recognizing that and sharing that is really important. I think that there's still some resistance when we do try to talk about the 3Rs, because people still in science tend to see that as a soft, veterinary thing, and the fact that we haven't been very good about acknowledging the changes that they have made has led to that a little bit. So, I think we all are on the same page. I think we use different language, and that's been kind of an obstructor to making progress with them. I think they when we talk about this, when I bring people in to talk about how can we work together better to enhance our program and maybe refine some of the work that we're doing or eliminate the need for certain types of work, they're very willing to do it if they can see the value and where it's going for them. But if we want to just talk about it in terms of what have we done and what have we done for animals, that's not a conversation that's very helpful to them at this point. So we just have to be talking a little bit differently when we do that. And I think that's one of the things that I've been learning through working with some of our scientists. As I said, I've been very fortunate to work in the field. In the culture I've been in, where there is a lot of support for doing things right, having good facilities, having good people, having good training programs, having all the right parts in place. I think that when I look at what I wish we would see is, even now, although I think that more and more of the young scientists coming on board have been raised with the 3Rs and have much more of an inclination to accept and understand the IACUC as being just part of life as a scientist, I still wish that the scientists could be the drivers for more of the changes that we need. We used to say that we have these meetings, like we would go to our ALAS meeting and we would talk about toxicology and how we could refine toxicology work. If you would have a conversation like that at a scientific meeting, think about the impact that that would have. And if it were the scientists having that conversation rather than the veterinarians or the IACUC staff or whoever having that conversation, how much more powerful that would be. I remember there were some projects going on where death as an endpoint was still considered the norm in certain fields, infectious disease studies or something like that, where they needed to have an assessment of this isn't working, this is working. We would talk about alternatives and what kinds of humane endpoints can be put in place. We could talk till we're blue in the face. All it would take would be a scientist standing up at a meeting of his fellow microbiologists or scientists and say, what are we doing? Why are we doing this? Why are we using this as our endpoint? And I think if they had that conversation amongst themselves rather than perceiving it as being our issue, I think that would make a huge difference in the way it was perceived. So that's what I look for happening someday is when, and there are scientists that do that, but not enough.